welcome Florence Atenya-Bonyo, Director, Audit, Appropriations and Other Select Committee. Committees with me is Mr. Michael Karuru, the immediate left, the Deputy Director, Legal Services, and behind him is a team of officers in the committee secretariat.
Thank you. So we'll give you 10 minutes to tell us the story of your life, whereafter we'll open the plenary to the committee to ask you whatever questions the members desire to ask you. But before that, let's do some check on your documentation to confirm. Do you have your tax compliance certificate from KRA? Switch on the microphone.
Yes, I do.
Do you have your Higher Education Loans Board clearance certificate?
Yes, I do, and I was not a beneficiary.
Do you have your clearance with the Ethics and Anti-Corruption Commission?
I do.
Do you have a certificate of good conduct from DCI?
I do.
Have you ever been charged and convicted of an offense in a court of law?
No, sir.
Are you a dual citizen of Kenya and any other jurisdiction?
I'm only Kenyan.
At a personal level, what is your net worth in terms of finance?
My net worth, Chair, is about 101 million, composed of a townhouse that I own in Syokimau. I have an apartment in Syokimau. I have some land in Kangundo. I have some land in Trans Nzoia County. I have land in Bungoma County. I have land in Kakamega County. I have shares and deposits in SACCOs, 2 SACCOs, Waumini SACCO and UN Women SACCO. I have dividends from where I have placed my shares, one of them, Cooperative Bank of Kenya. Thank you, sir.
We'll now open the conversation with the nominee. I'll give the first shot to the Deputy Speaker.
10 minutes first.
Oh, my. I'm so sorry, members. I think diminishing returns are setting in.
Speaker, it's 6:15. It's allowed.
Yeah.
But maybe there's something she said. You said you have shares in Cooperative Bank of Kenya or dividends as part of your declared wealth?
Shares.
Shares?
Yes.
And that come after her 10 minutes?
Yeah.
Okay.
You can interrogate her on that after her 10 minutes. You have now your 10 minutes or less to tell us the story of your life.
Thank you, Chair, and honorable members, for giving me an opportunity to appear before you this evening and tell the committee members and Kenyans at large the story of my life. I was born in 1979 in Kericho, specifically Londiani, to a policeman and a policewoman. And later they moved and we settled in Trans Nzoia County, in a place called Sihendu, where I largely grew up in that area. Members and Chair, as you are aware, policemen and policewomen in this country are people who are moved from one station to another. So my parents were being moved from one station to another to work. And it's that time that I was taken up by my maternal uncle, who I lived with during my primary education, which I finished at a school called Baraton Primary School. It is in Kiminini constituency in Trans Nzoia County in 1992. And I'm happy to tell honorable members that in the KCPE exams of 1992, I was the best student in then Trans Nzoia district. After that, I joined Maryhill Girls High School, a national school in Thika, where I did my secondary school education. While at Maryhill, I was engaged in several leadership positions, one of them chair of journalism, and then I thought that I would end up in media. And after Maryhill, immediately after, I got a call from KCB Bank to join them and work for them. And it was basically because I was very good in volleyball. So they were recruiting for their team. And my mom was like, who does volleyball for a living? So I did not join the commercial bank. So then I moved to MTC, Kenya Medical Training College, where I trained as a pharmaceutical technologist and graduated in 2000. Just to let members know that while at MTC, my parents, a policeman and policewoman, could not afford much. So from the second year of MTC, I did odd jobs to pay my school fees. After MTC, I managed to get a job in one of the pharmaceutical retail pharmacies in this country, where I worked for a period of time. During that time, I was also doing a degree in pharmacy, online degree from EG University in Turkey, where I completed. However, I did not get registered as a pharmacist because of the difference in legislation, the difference in the number of years covered in Turkey and covered in Kenya. But after that, while working, I proceeded to do a degree in procurement and supplies from Jomo Kenyatta University. And by the time I was doing that degree, I was working at Mission for Essential Drugs and Supplies. Chair and members, I stopped working in the pharmacy. My last stage as a pharmaceutical technologist was in charge of AAR Healthcare in Kisumu County. So when I joined MEDS, I started as a junior operations officer. But while working as an operation officer, one of my responsibilities was to consolidate orders and send medical supplies to faith-based hospitals in this country. I then realized that there was a gap, that anytime I was fulfilling orders from these faith-based hospitals, we could not fulfill them at 100%. And at that note, I told my supervisor that I think we have a problem in procurement. And I volunteered myself to work in procurement at MEDS. When I volunteered to work in procurement, that is when now I enrolled again for my master's degree while working there. And I ran through the ranks in procurement as an officer. Up to the time that I was leaving MEDS, I left as the procurement manager. And as you are well aware, Mission for Essential Drugs and Supply is the second biggest, largest medical supply chain organization in this country that is run in a way that I could say very efficiently. So I worked at Mission for Essential Drugs for a good 7 years. Chair, I left in good terms when I had just finished my master's. And for the members' sake, I briefly interned at KEMSA during my master's level for a period of 3 months. After that, Chair, I joined the Nairobi Women Hospital, where I was in charge of procurement. Chair and members, at Nairobi Women Hospital, I was in charge of end-to-end supply chain. What I mean by end-to-end is that I was in charge of the tomatoes that cooked the patient meals. I was in charge of the linen that was spread on patient beds. I was in charge of the equipment that was used in theater. And what many people don't like to hear, that I was in charge to ensure even the equipment in the mortuary worked while at MEDS. Honorable Chair and members, I left MEDS in 2016 to run for an elective seat in Trans Nzoia County, Women Rep. At that point, my party did not give me a ticket, so I dropped out at the nominations level. And I came back, and in 2017, I got another job with the Global Programs for Research, which is an affiliate of University of California, San Francisco, as their head of supply chain, and that is where I have worked to date. I took leave to also run for Women Rep in 2022. This time, I was lucky, I got the party ticket and went all the way into the elections. I didn't make it, and so I returned back to work after my leave. I'm still an employee of Global Programs for Research. Chair, I have been appointed on the Council of the Kitale National Polytechnic, which I joined in 2019. I served in the Education, Training and Research Committee. I served in Finance and Administration Committee, and I was the chair of the Human Resource Committee. Chair, I have also done consultancy services previously for Ministry of Health, in commodity management for Nyamira, Kisii, and Migori County, where I was training all cadres of health on commodity management. Chair, I've also done consultancy, which I'm still engaged in, with a firm called 54 Gene for Research and Discovery Limited that is scheduled to set up one of the biggest genomics laboratory in Kenya, and I'm still consulting for them. Chair, that's the story of my life, but I also need to say that I am married. I'm a mother of 2 biological children, but I take care of 2 as a guardian, and many that I take care who live with their parents. Thank you very much, Chair and members.
The floor is open. Members, we'll start with the debut speaker. Everybody will have a go.
Dr. Susan, congratulations again. I want to ask you this. As you know, we've had very many overlapping and fragmented schemes in the health sector. There is NHIF, there is Linda Mama, the civil servant scheme, the school children and elderly support schemes, and also some other types of social health insurance. The Kenyan Kwanza manifesto seeks to provide NHIF for all Kenyans without exclusion in a policy called Leaving No One Behind. What interventions will you propose to streamline NHIF and all these other schemes?
You will take 4 questions and answer them in the order that you desire. Kimani Ichung'wah.
Chair, maybe she would first begin by clarifying, because I heard Honorable Anyonyi refer to her together with the Deputy Speaker as doctor, whether she's a doctor, because when I'm going through copies of the certificates in our files, I don't see anything that has to do anything with a doctor other than the diploma in healthcare from Kenya Institute of Management. Maybe that would be the first clarification, because even the degree from Turkey is not in the file. I was asking about the dividends, because the shares, because looking at what you have listed as part of your wealth, the shares are not listed. Maybe you would also give us a schedule, probably, of what constitutes your net worth. But on to health issues, and I must indicate, sorry, I'm forgetting, Nakhumincha. I am rather impressed by her background in relation to what you have been nominated to do, especially on matters to do with procurement and logistics. And it's good that you have also interned at KEMSA. I hope that was not during the COVID KEMSA billionaires scandal. But having worked at MEDS, and you say it's the second largest, I believe, after KEMSA in the country, I would want to hear what is it that you will come to do at the ministry, that you streamline operations at KEMSA and make it more efficient, more cost effective for the people of Kenya in terms of procurement and delivery of cost-effective drugs to both our public and private hospitals, in line with our Kenya Kwanza manifesto. 2, the issue of community health volunteers in the country is an issue that has been debated over the years. I would want to hear your thoughts on what you want to do with community health volunteers that volunteer in our communities. Then eventually, finally, there are about 514 healthcare practitioners. If you may not know, you could or you may not know, I'm sure you've done some research at the ministry, that were interviewed in 2021 and they were given appointment letters by the Public Service Commission in December of 2021. Up to date, the ministry is yet to give them the appointment letters. I have not less than 15 WhatsApp and text messages from young Kenyans who had been given those appointments and now waiting for their letters. Do you imagine if you get approved and you take over the ministry, that you will ensure these Kenyans get the appointment letters, or from your initial analysis of ministry, is it that they don't need these young Kenyans working there? Do we have enough healthcare workers and practitioners? Thank you.
One day.
Miss Wafula, in the last term of Parliament, I happen to have interacted closely with the Ministry of Health as chair of the Public Accounts Committee, largely dealing with their audit reports. So I happen to have a rough idea of what goes on in the Ministry of Health. And you'll also recall that the current CS, because they haven't left office yet, the current CS, Mutahi Kagwe, when he came into office, promised to dismantle the cartels at Afia House. As to whether he succeeded in dismantling the cartels, the jury is out there. But coming back to you, even with your impressive technical background, do you think you have the wherewithal, the spine, to deal with these cartels? Because unless these cartels that have held Afia House hostage are dealt with and dismantled completely, we may not achieve much. So just give Kenyans and this committee the assurance that you are equipped, well equipped, to confront this mafia like cartels once and for all. Thank you.
Junet.
Thank you, Chair. Chair, my question to the nominee is, Chair, the functions of health are majorly devolved. They are under the new constitution, and there is a lot going on at the county level in terms of health. But likewise, there have been a lot of problems for the last 10 years since devolution came on health matters at the county level, where whether it is medicines, whether it is staff and medical personnel, there have been serious issues. What are your thoughts on how to deal with the ministry in conjunction with the counties at the county level? What do you think you can do differently that can make things work better this time? Secondly is the NHIF. There is a big problem in NHIF, and people feel that it's not functioning, it's not working properly. What do you think you will do differently that will make NHIF work like any other national insurance scheme, like the way the private ones perform for their clients? And lastly, there was this medical equipment leasing that was started by the last government, and it involved a lot of money, 40 billion I think, and it was imposed on the counties, and we normally deduct that money here when we are doing the division of revenue at the parliament level, at the source. Even the counties are not given opportunity to pay directly to the national government. Do you think that was a good scheme? Do you think it should be continued, or what do you think? What are your thoughts on that?
You can answer those four, then we'll take another batch.
Thank you, Chair and members. I will respond to the question in the order in which they came. Honorable Gladys, you sought to find out how I will handle the fragmented type of insurance that we have at the National Hospital Insurance Fund. And as you clearly put it, we have Linda Mama, we have the one for primary and secondary school children, we also have one for civil servants. Chair and members, I'm sure you already know, and if not, that Linda Mama is about 4 billion in a year. The one for Afia, for the school-going children, is another 4 billion in a year. And the other schemes, but collectively, just if I may use the example of those two, that means we have a total of 8 billion that has been fragmented. And in that fragmentation, you will note that a mother who is covered under Linda Mama also has a child who is covered under the Afya one. What that means is that that family has been covered twice in terms of payment. The one for Linda Mama has been paid for, the one for the education has been paid for. So what is supposed to be done is that we are supposed to consolidate. And that would be my suggestion, and it is also in our plan for Kenya Kwanza, that the payments are per household vis-a-vis per persons. Because if you take the total of Linda Mama and Afya, you put together the 8 billion, it can take care of very many households. And you know, per household in Kenya per year is 6,000 shillings. If you divide that 8 billion, I do not have a calculator with me, but I'm sure it will cover over 1 million households. So I will be suggesting and that we move and consolidate these schemes so that then we accrue a lot of benefit from it. And as you may be aware, members, is that insurance works on the premise of the more the better. So I believe with that intervention, we shall be able to streamline. Honorable Kimani, you sought to find out why the chair referred to me as Dr. Susan. As I said in my introduction, that I did a degree in pharmacy from Turkey. But I also said I did not manage to get registered by the Pharmacy and Poisons Board because of the difference in regulations. While I was doing that degree, I was working. I was required by the Pharmacy and Poisons Board and the regulations in this country to do another 1 year round internally, which I was not able to do. Because at that moment, I was still working. I had a life to live. I had beneficiaries that I had to take care of. So I wasn't registered. And because of that registration, I have always not placed my degree document in my folder so that then questions do not arise. You also sought to find out whether I have shares or dividends in Cooperative Bank. I believe, Honorable Kimani, you have better prowess in matters finance. Probably I was referring to dividends, whatever it is, but not shares. But I stand to be corrected, and I think my document shows whatever it is that I have. You also asked, on based on my experience, how I plan to streamline KEMSA, the cost of drugs, and the issue of community health volunteers. As I said in my introduction, I intend at KEMSA briefly.
Yes, Kimani.
Sorry to interrupt, but dividends are from Cooperative Bank or a SACCO? Because there's a reason I was asking that, because I see there's somewhere you've put dividends of 1.5 million and dividends of that amount from a bank that is probably paying 10 shillings a share. Would be a very huge investment, and it then would have to reflect in your list of assets. But maybe if it's a SACCO.
Thank you, Chair. I have shares and dividends from 2 SACCOs, and that is what makes up the 1.5 million. Back to your question on how I plan to streamline KEMSA. Having interned there, I have a view of what it is that happens at KEMSA as a public institution. And as I said, I also worked at MEDS, which is a faith-based institution. And what then I bring to KEMSA, which I'm sorry to say, but most of the public institution, there's some laxity in terms of operational efficiency. While there, I realized we had a problem with quantifications, how they arrive at what they buy for patients. And at MEDS, quantification was almost accurate to the point. How did we do it? Is that we got to know the needs from the faith-based institutions, faith-based facilities. Early in advance, before we did our tender process, we could find out from the hospitals what their requirements were. Based on that, then we worked on quantification. At KEMSA, they do a push system where then the stocks are pushed down to the facilities. And the facilities are supposed to be pulling from KEMSA. So the push system then means quantification is done at the top, at KEMSA level. And I'm happy because in Kenya Kwanza we are talking about bottom up. Therefore the facilities will be bringing up their quantities. Based on that, quantification is done. And that is why you hear at KEMSA right now we have expiries, we have obsolete, is because of poor quantification. So we shall start right by supporting KEMSA to ensure that they do proper quantification for products. Regarding cost of drugs, is again because of not quantifying properly, you end up buying wrong quantities at the wrong prices. But more importantly, my suggestion would be like, we do more of local manufacturing. We have molecules that can be manufactured in Kenya. For example, I'm yet to understand why we still import paracetamol. Yet we have companies in Kenya who are manufacturing paracetamol. If we were to buy from these locally manufacturing companies, definitely the cost of paracetamol will be much lower than the imported one. Honorable Kimani, the issue of community health workers in this country is that there are some success stories with community health volunteers. And I'll give an example of Kisumu County. They are moving on very well because they are giving stipends to their community health volunteers. And because this universal health care, they were doing some tests on a number of counties, then we should learn from the success stories like the one for Kisumu, just to find out how has it worked. Then that is what we can move to the rest of the counties within the country, that these community health volunteers then get a stipend, and it can be done on a matching basis, that as much as they are employed by the county governments, then the national government can match that stipend just to make them do more work. Then you spoke about the 2021 healthcare workers, and members through the chair, as you may know, as much as health was devolved on Schedule 4 of the Constitution, there's distribution of functions. There's what was left with the national government and what went to the county governments. Recruitment of healthcare workers, most of it is happening at the county government. So then I shall be working with the county governments, and it's supposed to be collaborative. And I am aware there are structures that have been put in place to ensure that the county governments are able to work with the national government. Then is to ensure that these healthcare workers are absorbed in their respective counties. So I may not be able to say that we shall give appointment letters, but once that discussion has happened, and I pray that this committee is able to approve of my nomination, then we should be able to work together to ensure that the workers are absorbed. As we know, most of the facilities in this country are ill-equipped. Even with the healthcare workers, there is a shortage. But also, the executive order, number 1 of 2022, has created a state department of health standards and professional management. So I believe under that state department, then the issues of professional management will be well handled as well in that state department. Thank you. Honorable Wandai, you are concerned about the cartels at Afya House, and I believe I am looking like I'm too weak to handle the cartels. But I would like to assure you that these cartels, having worked in healthcare and supply chain, I believe these are people that I have already worked with. It's just that on a small scale, but now they are on the national scales. And where I have worked previously, Honorable Chair, is that my mantra is P squared, R squared. P squared means process and procedures. R squared is rules and regulations. I am very sure that we will be able to break the cartels, but also be seeking the support of members through bills so that we improve on our procurement regulations and acts so that we are able to deal with these cartels, because at the end of the day, if healthcare is working, even the health of those cartels is taken care of. Honorable Junet, you asked about devolved functions in terms of the personnel and staff, and how to deal with the MOH and the counties. Honorable Chair, I am aware that we have intergovernmental forums that have been put in place. We have the Specific Health Sector Forum, that brings together the CECs in charge of health from the counties. They meet quarterly and they bring their issues from the counties to MOH. And the issues from these CECs of health then escalate to the Council of Governors. And therefore, I want to believe that the issue of healthcare personnel at the county level, then how the MOH will assist them, should be then discussed at this level. But I also want to believe that most of the time issues work when people are involved. And therefore, we shall be involving everyone, each of the health professionals from the counties, in decision making. NHIF, you asked, what is it that I will do differently? Through the chair, Honorable Jeanette, NHIF, as Honorable Gladys had said initially, is a bit fragmented. But the most important thing that I would like to let this committee know, or they may already be aware, that the population, the workforce in this country is about 16 million or 19 million thereabout. Out of this total population, 1 million is in public sector, 2 million is in private sector. So we have over 11 million people who are in informal sector. And these are the people that we are having a problem with in terms of registration and recruitment into the NHIF. So I will be working together with the county governments to improve enrollment. And through use of the community health volunteers, we should be able then to use them in terms of enrolling these people in informal sector. And you know, the people in informal sector, Honorable Chair and members, is that they rely on a day-to-day in terms of what they earn. Therefore, we have to devise mechanisms to ensure that even from the day-to-day, then we are able to help them to achieve the 6,000 monthly contribution to NHIF. But again, in our Kenya Kwanza plan, we are focusing on promotive, preventive healthcare, and therefore that will ease the burden in terms of healthcare needs. And the study shows that for every 1 shilling that you spend on promotive and preventive healthcare, you save 9 shillings in curative. So as an agent of the government, I'll be ensuring that then we focus more on promotive and preventive healthcare through the NHIF, where they can even have wellness schemes where people go for screening once in a year just to check their health status. Honorable Chair, a question was asked on MES, and you rightfully say that almost 40 billion was put into it, and what are my thoughts? Chair, while I worked at Nairobi Women Hospital, we were able to install 2 CT scans, one 64 slice and the other one 120 slice at 0 cost while I was in procurement. How did we do it? I sourced for the manufacturer of the CT scans. I told them that we have an opportunity, that we have patients, but we do not have the money to buy the CT scan. So we agreed on a revenue share agreement that they come and install the CT scans, we provide the patients, and we share the revenue. They take 80%, Nairobi Women takes 20%. And in that, we are able to install a CT scan at Adams and another CT scan at Rongai at 0 cost. What am I saying, Chair? That in the world today of management, there's what we call business outsourcing, that you are left to focus on your core mandate. For example, our hospitals, their core mandate is to provide healthcare. And therefore, if we have suppliers, and in this case we do, that supply the MES equipment, it is a good thing. All we need to be asking of ourselves is how was it entered into and how do we improve it? As I sit here today, in my home county of Trans Nzoia, we have a dialysis machine in Trans Nzoia County, which I believe Trans Nzoia County in itself would never have managed to buy that dialysis. So we have gains that have been made. Many counties, many patients have been able to access services that they would never have accessed before. But we have some small issues. For example, I'm told a county that has not installed their equipment because they were not able to get 3-phase power installation. What is that? Honestly, it takes a phone call from the governor to Kenya Power to have three-phase installation. So why should we keep equipment wrapped in a box waiting for three-phase installation? So I believe there are a lot of discussions that need to go into that, we look at the bigger picture, which is the benefits that have accrued from this equipment. And if there's anything that we can correct, then it is corrected at the review of the contract. Thank you, Chair.
Next batch, Owen Bayer, Honorable Robert Mbui, Mish Mbogo, Daud Posing. We'll take 5. Yes, I have not said I'll follow the line. I may skip and start with Naisula.
Okay, thank you, Speaker and Chair. Wafula, Susan, nice to meet you. I just have 2 questions. One very simple. If you look at Schedule 4, which you referred to, and Item 23, it talks about referral hospitals. That referral hospitals are managed by national government. But the practice in this country has been that referral hospitals, like the Moi, the Kenyatta University, the ones that are built by university, are actually managed by university. But we have very controversial issue at Kenyatta University and the referral hospital, where the university has actually been denied a chance to run the hospital and to manage it, and that other board members have been nominated by the minister and put in charge of the university, and they've been told this is a national referral hospital, and therefore even students at KU cannot access that facility. They have to apply like any other, and there has been a lot of controversy about that. As you step in, or if you are confirmed to step into the shoes of CS Health, how are you going to solve the problem at Kenyatta University teaching a referral hospital? Also, a health commission has been demanded. The health commission has been demanded to bring in all these services together, and we have a health commission in this country. It was one of the items on the BBI, and doctors and practitioners in health sector have demanded that counties should release the function, and that we have a health commission just like we have TSC and other commissions to manage medical services in this, health services in this country. What are your thoughts on this? Do you think that's the way to go, or we allow counties to manage the health sector and also the national government manage another sector? I thank you, Chair.
Thank you, Chair. I would like to say that
Owen, switch off your mic.
This nominee has been very clear in answering questions, and in fact quite impressive. Only that she repeated the P square and R square. I think it's a Kenya Kwanza new slogan. We had that earlier. But Chair, I'm aware that
Chair, on a point of order, Kenya Kwanza had no such slogan.
Chair, you have to tell the honorable leader of majority to relax. Sometimes you must, you don't take everything too seriously. But anyway,
allowed you to fish far and wide. So we
are in agreement on that, Chair. Chair, thank you. Chair, the Ministry of Health has in the past been a bit apprehensive about the introduction of genetically modified organisms, GMO foods. And until proper research is done so that the health of Kenyans that are, that partake of these foods is assured. In the recent past, and of course we know that the religious organizations have also been against it because of the fact that it's unnatural, because I think there is a belief that food should be provided in a natural manner in which God provides.